think the most challenging thing we deal with in the critical care and ICU setting is when we have to move into a palliative or goals of care discussion. So especially in traumatically injured young patients, you can understand that this is a extremely sensitive and devastating discussion that we as intensivists have to lead with families. So number one goal for me is to relate to the family. Again, I've shared this in other videos, but having a son now who's just over a year and a half old and spent 116 days in the neonatal ICU and has had 4 surgeries, I always considered myself previously a compassionate doctor, and that all dramatically changed for me once I was on the other side, if you will. So being able to relate to the families, I think, is really, really helpful. And giving them a realistic expectation, I think, is key to this, okay? And then if a patient isn't going to survive or care becomes futile, these are very challenging conversations about code status, especially in our geriatric population, and then what their wishes would be. So we have to just always go into this with an open mind and with compassion. And the next steps become even more challenging when we have patients that maybe are meeting brain death criteria, which is a whole nother kind of avenue that we have to go down. And worse than that is even the patients that are in this in-between kind of place where they don't meet brain death criteria with a bad traumatic brain injury, but their chances of meaningful outcomes, which is what we are always striving for, is minimal. So those are actually the most challenging situations that we deal with. But we have an outstanding palliative care service. It's something that I encourage everyone to utilize, even if maybe going down towards hospice is not the end goal. They still are extremely helpful in those end-of-life discussions, but it's something that maybe we don't talk about enough. And I encourage everyone to have a living will, have their wishes in writing, so that God forbid something does happen to you or your family members, you know, there is a game plan and people understand and can respect your wishes, because at the end of the day, that's really what matters. And the next of kin, if you will, has to make those decisions on your behalf if you don't have something already set in place. So again, an extremely challenging situation for anyone to ever be in. And you know, it's something we deal with every day, and it is the most challenging part of the job, without a doubt.